Yo, what is going on YouTube? I am Germ here, as you guys can see up on the screen today. I wanted to talk a little bit about Corvus Pharmaceuticals. This is ticker symbol CRVS, and the reason we're talking about this one is pretty obvious. It's up 135% during the trading day today, and it did not stop there. It is up another 16% after hours. This is absolutely insane. Now, this is a $225 million stock right now at the time of recording this, so it's not exactly the biggest company in the world. It is definitely a small cap stock. It is definitely a very, very volatile and very, very reactive to news type company, especially being a pharmaceutical company, a biotech company, all of that stuff. But when you have 135% plus gains in a single day, people are going to wonder what the heck is going on. People are going to be talking about it, and we're going to be covering all of that in this video today. So definitely drop a like if you guys do enjoy it. I would appreciate it so much. Subscribe to stay up to date on all my latest content, and check out the first link in the description below if you want to receive a free stock just for signing up with Robinhood. With that being said, here we go. We have this article from Yahoo Finance. What's going on with Corvus Pharmaceutical stock today? That is exactly what we're wondering. This is exactly what we're looking for. So hopefully they have some good information for us. CRVS is surging higher Friday on abnormally high volume. The stock might be trading higher following favorable data results from AstraZeneca, AZN, for patients with unresectable stage 3 non-small cell lung cancer. Now, obviously, that doesn't, ring any bells right off the bat. Like, okay, AstraZeneca released some positive news, and now all of a sudden, CRVS is up over 100%. We see at the top of the screen here, AstraZeneca is down 2% on the day. So, what the heck could this news possibly be that has AZN going down and has CRVS going up this much? Do they have some kind of partnership, some kind of agreement in place? What the heck is going on? It's very, very vague so far. The average tested volume of over 100-day period is about 300,000. Friday's volume was 120 million. So, a crazy day for Corvus, just kind of coming out of absolutely nowhere. But the AZN news that is apparently affecting CRVS in such a massive way is that they announced their COAST Phase 2 trial showed Aliclumab, I don't know, an anti-CD73 monoclonal antibody, or, I hate saying these names, guys, an anti-NKG2A monoclonal antibody in combination with Imfinzi improved progression-free survival and objective response rate compared to Imfinzi alone in patients with unresectable stage 3 non-small cell lung cancer who had not progressed after concurrent chemoradiation therapy. And again, what the heck does that have to do with CRVS? The big thing here is that the results may be positively impacting Corvus Pharmaceuticals because they have a CD73 asset in their pipeline. So again, if these studies are showing that the CD73 assets can be very, very valuable and they can help out other drugs, they can be really, really effective in combination with some other treatments, all of a sudden the demand might very, very largely rise for a product that CRVS has, and they might even be able to partner up or work with AstraZeneca, or at the very least, every time AstraZeneca wants to put this treatment in place, and they have obviously their drug that needs the help of another CD73 asset, that CRVS might be called upon, and it might be a very, very big and huge opportunity for them to really just become a massive player in this market, in this field, which could be very, very cool. Corvus Pharmaceuticals is a clinical stage biopharmaceutical company engaged in developing drugs and antibodies that target the most critical cellular elements of the immune system. So yeah, kind of crazy there, kind of really, really big news. Again, it'll be interesting to see with these small cap stocks. You never really know if people are accurately responding to the news. Like 135% jump, that could be a huge, overreaction to this news. It could be, whoa, guys, in a couple weeks, couple months, couple years, we're going to be like, all right, this wasn't actually that big of a deal. It also can be huge underreactions because so many people don't know a lot about this. We don't know what exactly this is going to mean in terms of sales or numbers or revenue. Just because they have an asset in their pipeline doesn't even mean that it's going to, be successful, or it's going to pass all the tests and trials, or it's even going to be as good as maybe people think it's going to be. And that doesn't mean they're not going to have other competitors in the market now that, people are knowing that these CD73 assets have such a strong use case or such strong value. And also these smaller cap stocks can get caught in these huge upswings where people FOMO into them, or algorithmic traders, end up getting caught buying and buying and buying, probably more than they should. So that is just some of the many reasons why these biotech stocks are so volatile, so crazy. But definitely, if you are interested in something like CRVS, dive into it, dive into the research, dive into the studies, dive into some more articles, learn as much about it as you can. And if you think that this is an underreaction, maybe this could be an interesting investment opportunity for you, or at least a company or stock to look at. Maybe you think it's an overreaction, maybe you think it's something you want to stay away from altogether. But again, go find all the information you can about it. But just know that this is going on right now. This is why CRVS was popping, and it was so hot today. But that is pretty much it for this video today. Definitely drop a like if you did enjoy it. I would appreciate it so much. Leave a comment down below. Let me know what you think about CRVS. I would love to hear your guys' thoughts and opinions. Subscribe to stay up to date on all my latest content. Hopefully catch you guys in the next one. But until then, peace.